Right, glad to know that you're still out there watching New Day on PTV. 56 countries live from Abuja. And like we told you, we'll be having a guest in the house. We have members, from the Nigerian Medical Association, and we'll be talking about the Johesu strike vis-a-vis the threat issued by the NMA. That they will also embark on the strike if there's an if that I want to talk about today. And with me to discuss all of this is the president of the Nigerian Medical Association, Dr. Francis Faduyile. Thank you very much, doctor, for finding a time to be here.
Thank you very much. It's a pleasure being here.
I hope the patients are doing very well.
Well, we are doing our best.
All right.
Good jobs. Hospital open.
Okay.
Thank you.
All right. And I will also have to my far left Dr. Nosa Lancy Orhue. I hope I have that correctly. He's the National Chairman, Remuneration Committee. Thank you for finding our time to be here today. All right, President. Johesu has been on strike for over agitation that is behind the strike is the fact that remuneration disparity between doctors and health workers. What is your take on this? Is this healthy for our health institutions?
Well, thank you very much. I will have asked what you mean by is it healthy? Because the norm everywhere in the world is that every cadre or every professional group within the health sector have different grades of remuneration. Okay, and Nigeria is not an exception. Medicine is not manufactured in Nigeria, and we don't practice medicine according to our whims and caprices in Nigeria. What has been in place is what is the international best practices. How do I mean? What is obtainable is that at different stages we have the grade level and the payments for doctors at this ratio, to other staff at this ratio, and to the junior, very junior staff at this ratio. That is what had been, okay? And ab initio before 1975, the ratio was between 3.331 to 1, okay? But with successive government and successive agitation, we have had the ratio being reduced to between 1.2 to 1.5 today. And yet, with doctors giving having the large our friend level and the level. Why have you gone to medical school? Where is the role of your responsibility? Where is the role of your activity? And where is the role of your expertise? Okay? So these are the things that actually make the difference. Anybody knows today that it is the doctor who takes final or absolute responsibility for the care of patient. If any patient is not treated properly, the person that goes to meet the tribunal, the court, is the doctor. So, doctor has that responsibility. Yet, you want every other staff to take the same pay. I think we are taking it too far. I had my friend from your previous interview giving a lot of grade level, very confusing. But the question I want to ask is that are other health workers who are in medical profession, are they collecting the same amount of money with their peers who are in the ministry? The answer is no. What extra thing are they putting on the table For example, the administrative staffs. What extra thing are they putting on the table that is different from those who are in the civil servant, who are in the ministry? Nothing, absolutely nothing. Why you are not looking at that vantage position for being in the health institution, you are looking at doctor is this, then you must pull doctors down. And I think that is where the whole scenario of agitation got started. We need to know that you cannot just wake up and just say, this is this, then you must have it this way. And that is what we see that is happening. For emphasis, doctors, Nigerian Medical Association is not opposed to any group getting any pay rise. However, the relativity, which had been reduced from where we were 3.3 to 1 to about 1.2 to 1.5 to 1, we can't go further. Get your pay. The government has signed an agreement with us. Then give us that relativity. Once it's maintained, everybody goes home. But their worry is that no, you must bring doctors down. You can see how things are. So those are the things that are causing the confusion.
From point one, that's a massive reduction for the doctors. Now, do you think that while they've agitated in the past and they got results, could that be a yardstick for them to, come back again and say, no, if we can do this in the time past and we have this massive result, come on, we can go back and do the same thing so that we can have that, parity that we've been talking about. Do you think that that's a key driving point for Johesu?
Certainly, I think so. Why do I think so? Between 1998 and 2014, doctors' salary grade. Unfortunately, one of the least things we should be talking about is about salary grade. It should be how we want to take care of our patient. However, if it has come to this, let us discuss it. Doctor salary grade had been compressed, that we had almost nothing in terms of parity. For close to 10 years, we needed to painstakingly let the government know that, look, there have been an injustice done on us. Okay? And in this injustice, it was corrected in 2014. And that is why we have some correction on our salary grade. And even with this correction, they did not go to where we are supposed to be. We accepted it. What they are asking now is that, look, they want to abrogate this correction again, and they want to have the same pay with doctors. That cannot happen. Okay? What we are saying is not peculiar to Nigeria. It's not a Nigerian thing. It's an international thing. Okay? If you go to South Africa, to Ghana, we have the ratio of what A, B, or C collects. Okay? And it is international. So what they are asking, I think, I think sincerely, they want to overreach their bounds. If you want to be a doctor, if you love that profession, you see that they get that big pay. I think the medical schools are still wide open. We have people who are close to 40, 50, who have gone back to school to become a doctor. Okay? Yeah. And the group of people these are friends are targeting are not the first degree doctors. They are the specialists. Okay? They are the specialists.
Okay.
And it's these specialists that will help to strengthen and improve the health system in this country. What we are seeing now, you are seeing a lot of specialists dissatisfied with the work environment, with what happens within the hospital, as well as the equipment that they cannot perform optimally. And a lot of them are in drones. They are leaving this country. Nigerians and patients will be what's up with this struggle. That you want to get what you can't get as a medical doctor through the back door. We are fighting for the soul of health sector, for the patient, because for every part, every profession, or every professional that is working within the health sector, they are all important. The nurses, the pharmacists, even the cleaners are very important. We do not look down on them. However, we must know our bond, work within our bond, and know that we have hierarchy. It is when you have caused this distortion, it may not only be in terms of pay. Once you know that this is your work, this is what you need to do, and you see people who are not at that level now competing with you, and because of their share number, they want to change things. Because we are in democracy, we are talking about number, you are seeing a lot of agitation, you are seeing a lot of flexing of muscle. The next thing you want to do is to step aside. Once you step aside, specialists leave. Who now is the person who is suffer it? The patient. We are appealing to the patient to talk to our government that enough is enough. They have gone ahead at a time that the agitation was rife, was high. And what they decided by the government at that time was to set up a committee of technocrats led by former secretary to the head of service, Yayale Ahmed. They went round the countries in this world, the advanced and the developing, and they came out that there is relativity. They came out that these are the organogram in the hospitals. As that paper was going to be made into a white paper, our friends ganged up again and said, no, they don't want it. Are we going to practice this babalawo you are talking about in Nigeria in Orthodox? So these are the situations and these are the issues that we want Nigerians to listen. If I start saying this is my salary, this is where I hear, this is this, we have actually deviated from why we are primarily in the hospitals. They have so many requests. They want to be director, they want to be CMD, they want to be consultant, they want everything a doctor gets in the hospital without going to medical school.
Well, maybe while in the hospital, they feel that they are in the medical school. All right, very quickly, when you emerged as NMA president, you were being quoted as saying that what Johesu was demanding is legitimate. So what has changed now that you happen to be the president?
No, I gave a press conference after I became president, and I stated that federal government should honor agreements. Agreements means if Johesu needs things, if it's their legitimate right, give it to them. Agreement means since we have had an agreement of relativity, whatever is given to them, ensure that relativity is maintained. Okay? We have never opposed to career progression, to salary increment for these our brothers and sisters. We have never opposed to that. But we are opposed to some certain things that they are asking. For example, in core civil service, we have directors. Directors can just be one or two. They are not proliferated in core civil service. In medical profession, we have consultants, and we have there are different level of chief, whatever it is. Okay? For the pharmacist, you can be chief pharmacist, principal pharmacist, whatever it is. For doctors who are not specialists, you can be chief medical officer, principal medical officer, different levels. However, their level in civil service, their counterpart can be at the level of assistant director, deputy director, or directors. Okay? But the teaching hospital has an act that we can have about three directors. The chief medical director, director of administration, and director of clinical services and training. However, these are brothers and sisters. They said if they get to level 15, level 16, they want to be given that nomenclature director. What it means is that since we can have 10, 20 people who will be at that level, then they should be directors.
But before you emerge as president,
yes.
I am still you still not answered that question. Did you at any point said Johesu's demand is legitimate? Did you at any point? Because we've got quotes, we've got responses from some of the Johesu members who actually quoted you by saying that you came out to say whatever Johesu is demanding for is legitimate. Did you at any point make that statement?
Sincerely, I can't remember making that statement. What I made, the statement I made was that government should honor agreement with health workers. There is one particular newspaper that changed that health workers to Johesu. Government should honor agreement with health workers. Then it changed it to government should honor agreement with Johesu. Okay? That is the view of that reporter to change that health worker to Johesu. Okay?
Okay, let's hold it there. Now you are the one interpreting all of that. Now back to Dr. Nosa. Dr. Nosa, what exactly is your own view, in this whole saga, talking about Johesu, talking about NMA? You are part of the Remuneration Committee. Do you think their demand is legitimate?
My president has given a very good synopsis of the picture. Johesu's demand, they have right to demand for what they want. But their rights should not also affect another group's right. Their right should not also affect the collective bargaining agreement signed freely between a group, this time the Medical Association, and the federal government. Now let me tell you the wisdom why that agreement was signed. Like the president actually said, previously there have been a lot of discussions. During the colonial era, post-colonial era, and now during this democratic period. Salaries have been increased, reviewed, adjusted, but one thing kept repeating itself: distortion. You are in Nigeria, most of the time when we do our things, we usually don't do things with excellence. And at the end of the day, we were able to prove to the government that there is a pathway that we need to follow, and that pathway is to have an agreement on relativity. When we say relativity, we are talking about ratio. If you are paying a doctor 1 naira, you want to pay another person maybe 50 kobo. Now, in that 2014, we agree with government that when a doctor who is a fresher comes in to the service, he should be paid the same salary as somebody who is on Congress 9, step 4. While a Johesu member will be paid Congress 9, step 1. Now, at the level of the medical officer, Johesu will not tell you this. There is no relativity. There's no relativity. If you pay a medical officer on grade level 12, 1 naira, you pay a Johesu officer on grade level 12, 1 naira. Have they ever said that? They have never said that. Now, when you move to the next level, you pay them 1 naira, you pay doctor 1 naira 20 kobo. Like that till you get to the highest, the specialist. Now, the wisdom behind it, this is what I want government to listen to. The wisdom behind it is that if you increase any salary for a doctor, the health worker salary should also move with the same rate of increase.
if you reduce the salary for a doctor, the salary of the health worker should also reduce at the same rate. Ditto for Johesu. So it is, if you go up, all of us go up. If you go down, all of us go down. But that relativity should be maintained. So I think it was a wise thing for government to have signed that, you know, which will sort out all these problems rather than ad hoc measures, you know, being applied. So they don't want that ad hoc measure. I mean, they want that ad hoc measure. We don't want it. We want to be very scientific, which is what we have done. And the only science we can adopt is to follow relativity as that now approved by government. So I would like to appeal to them to allow that relativity to stay, because it will also to their own advantage. We actually did a detailed assessment, and we found that at a particular level they earn as much as 70% higher than the regular civil servant. 70%. Do they say that to the public? No, like the president actually said, they are looking at just the doctors without looking at the responsibilities that the doctors carry. Recently, some doctors were found wanting by the Medical and Dental Council of Nigeria. What they use in finding them wanting? They said they are the responsible medical officers. They were sanctioned. All the other health workers, those who were engaged in block grouping and cross matching, and the nurses and the rest, no one has invited them for any punishment. But it's the doctors that have been suspended. You want them to have that responsibility, but when it comes to payment, you say they should not get advantage. I think that is it's not natural. And I think we have to do something. It's only something that is natural that can stand the test of time.